All right, so the defense is now presenting the jury with its own witnesses and evidence in the trial of Lindsey Clancy. The prosecution rested its case Monday. Clancy, if you've been following all over social media, is the Massachusetts mother accused of murdering her 3 young children in 2023. Whether the 36-year-old fatally strangled her kids is not an issue. She admits to doing so, but her defense says she was suffering from postpartum psychosis. Clancy could go to prison for the rest of her life if she is convicted. If not, she will likely be committed to a psychiatric hospital. And this case has been in the headlines for some time now, and it is also raising questions about the diagnosis postpartum psychosis.
Yeah, this is such a fascinating situation. Here to give us some insight is 9 News medical expert Dr. Payal Kohli. Okay, so many people have heard of postpartum depression. Postpartum psychosis is something that's completely different and often misunderstood. Let's start with the basics. What are we talking about here?
Completely different, guys. So postpartum depression is your average sort of baby blues, right? You're feeling down, you're feeling tired, you're feeling anxious, you don't bond with the baby. That is a completely different diagnosis from postpartum psychosis, which is much more rare. It's a psychiatric emergency. So I want you to think about it like a heart attack or stroke. If you see signs of this in someone, you need to rush them to the hospital. 1 to 2 out of every 1,000 live births. So it's usually first-time moms that are more likely to have it if you have a history of bipolar disorder or schizophrenia or anything like that. But you're disconnected with reality. So you're having bizarre thoughts, you're having delusions, you're having paranoias. I remember in medical school, usually happens a few days right after delivery, about 3 to 10 days. We walked in and she thought we were trying to steal her baby.
Wow.
And there were cameras on the maternity ward and she thought the government was watching to figure out how to steal her baby. And it was pretty obvious that she had postpartum psychosis.
Wow.
I'm glad we're talking about this because I know Lindsey Clancy tried to get help numerous times and was met with, normalization, I guess, of her symptoms or not the right medication. That's a whole nother conversation. But her youngest, and it's just such a heartbreaking, tragic case, her youngest 8 months old.
Yeah.
How does the timing typically with postpartum psychosis work? Like, does that make sense for being 8 months postpartum?
No, it's a little atypical, to be honest. So usually, like I said, it's days, about 3 to 10 days. It can happen about 4 weeks after. And so the DSM, which is sort of the psychiatry criteria, says it should be no more than a month. Now, the ACOG, which is the American College of Obstetrics and Gynecology, says it can be up to a year that you can have this. But again, Lindsey was talking about a lot of the insomnia, the anxiety. Those are sort of atypical symptoms for postpartum psychosis. It's more of these bizarre thoughts of hurting yourself or hurting the baby, so suicidal or homicidal thoughts as well. And we think it's really a complicated phenomenon. I mean, obviously the hormone surges is a big piece of this, which is why that first period, the first 4 weeks, is the highest risk because the estrogen drops, the progesterone drops, and that can, in a susceptible woman, trigger this psychiatric illness. We also think it has something to do with sleep. In fact, women, before they sort of have this postpartum psychotic break, so to speak, it happens suddenly, they often have days where they haven't slept properly, either because of the baby or for other reasons. And then we think the immune system plays a part in this as well, because our immune system changes after pregnancy, and maybe that triggers it too.
Interesting.
Really interesting. One other thing her defense is trying to claim here is that the medication she was on actually made her symptoms worse. Is that possible?
It is possible. And this is the thing they always teach us in medical school, that when somebody is depressed, they're so depressed that they can't even activate enough to hurt themselves. You give them an antidepressant, you can sometimes give them just enough energy to do something. Same thing for a psychotic patient. They're psychotic, but they're just not able to get over that hump. You trigger just enough activation to actually do something. I think this really highlights the gaps that we have in our system. And I have to say, as a physician, I saw one patient with postpartum psychosis. I spent 2 hours in a lecture on postpartum psychosis, and that's it. We don't have a systematic system for screening mothers. Doctors aren't comfortable with it, but I also think mothers aren't comfortable to talk about a lot of their symptoms as well when this happens.
Good for you, Dr. Kohli, for saying that. I completely agree with you. Another misconception is that the women that do suffer from postpartum psychosis are always violent. Is that true?
It's not true. In fact, it's rare. So obviously they're at risk for infanticide, which is hurting the baby or killing the baby, hurting themselves. But it's really actually rare that they have violent delusions. A lot of times it's delusions of persecution. They're trying to be more defensive because they think that someone is going to hurt them, not so much that they're trying to hurt someone else. Once in a rare while, you'll see kind of more global sort of delusions, like there's toxic gas coming out of the fridge, or they suspect suspect that the father is trying to do something, or other family members or such. But for most part, women have delusions that are disconnected with reality, not so much thoughts of hurting someone else.
Yeah, wow. Well, such a fascinating trial and such a fascinating situation. And thank you for bringing that insight to us.
And just what a tragic loss,
I
you know?
Heartbreaking. I know. Beyond. Dr. Coley, thank you.